Measles vaccination. Myths and facts. Notorious for causing a serious flu-like ailment with a rash, measles is a highly contagious respiratory disease. 3 out of 10 people who suffer measles get complications, and severe measles is more likely to occur in young children. Most of the patients will suffer from ear infections and diarrhea. 5% will get pneumonia, 0.1% will have cerebral edema, brain swelling, a life-threatening condition which may lead to deafness and intellectual disability, and from 0.1 to 0.2% will die. Prior to the presence of measles vaccine in 1963, nearly every child got measles by the age of 15. Every year 3 to 4 million people were infected with measles, leading to approximately 500 deaths and 48,000 hospitalizations. Dangerous as the disease itself, nowadays our efforts to keep the society safe from measles are being threatened by the phenomenon of vaccine hesitancy, giving this disease a chance to continue to rage around the world. As vaccine hesitancy is related to many outbreaks worldwide, in 2019, WHO names it as one of the top 10 health global threats. The safety, effectiveness, and importance of vaccine for measles, mumps and rubella, MMR, preventions to public health, is confirmed by the Infectious Diseases Society of America, IDSA. This video presents Measles Vaccination. Myths and facts. Myth number 1. Autism is a complication of measles, mumps, and rubella, MMR. Fact. While no evidence shows the connection between MMR and autism, a myriad of evidence has proven that MMR has nothing to do with autism. According to recent research involving 650,000 Danish children, along with many other studies, MMR is not related to autism and also does not increase the risk for autism, trigger autism in susceptible children, and cause clustering of autism cases after vaccination. Myth number 2. Measles outbreak does not happen. Fact. The world has suffered a huge number of local and regional measles outbreaks coast to coast. An outbreak occurs when a community witnesses more than 3 cases. In 2000, the United States managed to eliminate measles out of its territory. However, in 2019, the disease returned to the country and caused the greatest number of cases reported. If it hadn't been for the MMR vaccine which has been given to most Americans, the number of cases would be much higher. Making sure that 90% of the population get vaccination decreases the likelihood of measles spreading among those who don't. This is called herd immunity, which protects people who can't get the vaccine, such as infants who aren't old enough, and people with a weakened immune system, like those having HIV/AIDS or cancer. Measles outbreaks can rage throughout the community if local vaccination rates are lower than needed for herd immunity, most often when people carry the disease from their home country to the US. That's what we've been seeing in recent years. Regarding the highly infectious nature of measles, these outbreaks are no jokes. It is estimated that 90% of non-vaccinated individuals get infected when exposed to the disease, making it much more contagious than the flu. Myth number 3. Proper sanitation can prevent measles from spreading. Fact. We all know that better sanitation means lower rates of diseases spread through food or water, such as cholera and typhoid. In fact, its effect on measles is just a drop in the ocean, as this disease is spread from person to person through the air. Myth number 4. Measles vaccine does not contribute to the decreased number of serious illness and death. Fact. Every year thousands of lives are saved due to the availability of measles vaccine. There was indeed a decline in the number of measles deaths before the introduction of the vaccine, thanks to considerable advances in healthcare, which enhanced the effectiveness of treatment for people with diseases. However, we still witness serious illness and death from measles on a regular basis. Statistics show that 500 measles-related deaths were reported to the CDC every year before the vaccine was introduced in 1963. Since then, U.S. measles-related deaths have been increasingly rare because the vaccine has done its job nicely. The latest death related to measles in the U.S. was in 2015. From 2000 to 2016, the number of deaths associated with this disease decreased by 84% globally, thanks to the vaccine. Escaping from death, 25% of people infected with measles suffer serious illness and require hospitalization. It is clearly seen that the vaccine has been playing an effective role in reducing measles illness. In the course of 56 years from the mid-1950s to 2001, the number of measles illness has reduced 6,000 times. Recently those numbers have been increasing due to local outbreaks. Myth number 5. Measles vaccine can cause death. Fact: no deaths have been proven to be caused by the measles vaccine in healthy people. Vaccine side effects did result in some rare cases of deaths in children with immunodeficiency who are recommended not to get the vaccine. That's why people who are healthy have to take the vaccine to protect those who can't. Possible side effects from the vaccine include sore arm from the shot, fever, mild rash, temporary pain, stiffness in the joints, and a very small risk of febrile seizures or allergic reaction. Vaccines undergo scientifically rigorous research and vetting process before they are approved. Getting the vaccine is much safer than getting measles. Myth number 6. MMR vaccine can be the cause of measles. Fact: that MMR is made using the weakened, attenuated form of the virus means that after injection, the virus does not exert any harmful effects on the vaccinated person. In fact, the vaccine helps that person's immune system to recognize the virus and build up immunity to protect the body. However, after getting vaccinated, some children may experience mild symptoms such as a fever or rash. This is because their immune system is working hard to build immunity against the measles virus so that they don't get sick if they're ever exposed. What do you think about the MMR vaccine? Tell us in the comments section below. Thanks for watching. If you find this information useful, please give us a thumbs up and share it with your friends.